Welcome to Rajendra Tandon videos. We take up a symptom which is quite common, although it seems to be not so common. I refer to internal hemorrhage. Bleeding ought to be taken seriously whether the flow of blood is more or less, external or internal. Parts of the body bleed if a blood vessel, whether a large artery or a narrow capillary, breaks. External injuries can cause external and sometimes internal bleeding as well. Coagulation of blood under the skin makes it look purple. Internal bleeding from an injured muscle or a joint can cause inflammation. Bleeding inside the body can also be a result of a disease affecting a particular organ. Hemorrhage in the brain is a life-threatening situation. An artery may burst because of high blood pressure. Reach for a doctor, a hospital. Internal bleeding can be in the eye, the retina or conjunctiva. Bleeding can occur from the ear in an acute middle ear inflammation. Bleeding can occur from inflamed gums. In lung cancer or cancer of the larynx or in tuberculosis, a patient may throw blood while coughing. The esophagus or the stomach can bleed. The patient vomits blood. Bright red color blood indicates that the bleeding is fresh. Vomit of dark blood could mean cancer. It also shows that the blood has been in the system for some time. Blood may also pass through stool, which gets darker. In the lower digestive tract, bleeding can be copious and the resultant stool black or like tar. Blood in urine can mean a simple infection or a cancer of the bladder, stones in the kidney or in the bladder. Piles and anal fissures also bleed bright red blood. Bloody dysentery is painful and debilitating. In women, any bleeding other than menstruation requires medical attention. For internal bleeding, administer a dose of milefolium 200 as a first aid. Repeat every 4 hours. Seek medical guidance in all but simple superficial bleeding situations. However, the following remedies would help immensely. Cases of food poisoning require arsenic ALP 200. The patient vomits blood, bile, green mucus. There are cases of the cancer of the stomach, where brown, black vomit mixed with blood occurs. There is total prostration, restlessness, intense heat. Arsenic ALP 200 is the remedy. When there is blood in urine from kidney or bladder, constant urge to pass urine, cutting pain before, during and after urination, we use Cantharis, Cantharis 200. In cases of persons who are continually sick, who bleed from weak and spongy skin, from nose, lungs, stomach, bowels, bladder, Haemorrhage 200 has to be given. For simple nosebleed, we give Cinnamon, Cinnamon 30. Cinnamon 30. It's a common occurrence in children. Also for post-delivery hemorrhage, bright red blood in early, profuse and prolonged menstruation. When the blood is clotted, black and stringy, clots with long strings from uterus in threatened abortion, use crocus, CROCUS 30. When bleeding occurs and the blood does not clot, non-inflammatory retinal hemorrhage, blood from ears, dark bloody urine, intestinal hemorrhage, blood dark, blood is oozing from rectum when standing or walking, cancer of the tongue with bleeding, black or ground coffee colored vomit, cancer of the stomach with bloody slimy mucus. We prescribe Crotalus H, CROTALUS H 200. In painless flow of dark, clotted and venous blood, which does not coagulate, remember, it does not coagulate, piles exuding dark blood, blood from anywhere, Hamamelis, HAMAMELIS 200 comes handy. And for mother tincture, used for local application on piles, etc., you get great relief. For blood and pain in dysentery, when the stool is hot and slimy and there is persistent tenesmus, there is a feeling of never get done, it's a very important symptom. Merc Cor, MERCCOR 30. In cases of bright red blood while coughing from lungs, from nose, from bowels, in urine, from urethra, from piles, Millefolium 200, MILLEFOLIUM 200. When the menses are early, profuse and protected, again Millefolium 200. If there is bright red blood from the bowels, cases of bleeding ulcers, give nitric acid 200. Patients suffering from typhoid may hemorrhage in their stool. The patient grows faint, feels dizzy while bleeding. Bright red blood in sputum while coughing. In abortion, in climacteric. From fibroids, chronic uterine bleeding, bloody diarrhea with mucus. These symptoms require phosphoric acid 200. And when the patient grows faint, feels dizzy, give trillium, TRILLIUM 30 internally, and mother tincture for external application. This is the medicine for bright red blood in sputum while coughing, in abortion, in climacteric, blood coming from fibroids, in chronic uterine bleeding, bloody diarrhea and mucus. Listen to the symptoms carefully, choose your remedy, you would not be disappointed. In cases of simple nausea with bleeding and wheezing, give Ipecac 200. Thank you for visiting this site and listening to me. I hope you would benefit.